Hi everyone, my name's Hilton Menz and I'm Professor and NHMRC Senior Research Fellow at La Trobe University in Melbourne. And for this presentation I'd like to present the findings of a study which was designed to explore the incidence and progression of hallux valgus. Now before I do that I'd just like to acknowledge my co-authors from Keele University in the UK, Dr. Michelle Marshall, Dr. Martin Thomas, Dr. Trishna Rathod Mistry, Professor George Peat and Professor Ed Roddy. Now, of course, hallux valgus is a condition that we're all very familiar with. We see a lot of this in clinical practice. And we know from the literature that there's a range of factors that are associated with hallux valgus, including increased age, female sex, there's a genetic predisposition to the condition, there are certain foot structural variables that predispose someone to develop hallux valgus, and of course there's the contribution of shoes with a narrow toe box. Now, one thing we don't really know much about, though, in relation to hallux valgus is what happens to it over time. Now, hallux valgus typically develops in the 30s and 40s, but we don't really know much about its natural history. Now, there's been 3 studies that have looked at the progression of hallux valgus over time. The first one was a very small study of 38 surgical patients, which demonstrated that the hallux valgus angle only increased by about 2 degrees over a 2-year period. Second study showed that 42% of people with unilateral hallux valgus progressed to bilateral hallux valgus over a 5-year period, and a third study showed that progression, which was defined as an increase in the angle of more than 5 degrees, occurred in 26% of patients over a 2-year period. However, there's several limitations to these studies that have generally been conducted in fairly small samples of varying age ranges, and they've used a lot of different definitions of hallux valgus. So the objective of our study was to address those 2 remaining questions. What actually happens to hallux valgus over time, and what factors are associated with those changes? So this study was part of the clinical assessment study of the foot, which is a prospective cohort study conducted in the UK. Now, participants were all aged 50 years and over, and they were drawn from 4 general practices in the Staffordshire region. There was a postal survey and a follow-up of that same survey 7 years later. Now, participants graded their own hallux valgus using a validated set of line drawings, which I'll show you a little bit later on. We had complete data available from 1,482 people, mean age of 63. And then we examined these data at baseline and follow-up to identify predictors of hallux valgus incidence, so new cases of hallux valgus, as well as progression of the hallux valgus angle. To document hallux valgus, we use this standard set of line drawings. And as you can see, there's 5 different severities of hallux valgus depicted in these drawings. And the difference between each of those is approximately a hallux valgus angle of 15 degrees. So it sequentially increases from 0 through to 60 degrees of hallux angulation. We also needed to come up with a dichotomous definition, so to classify people as having hallux valgus or not, and to do that we considered grades A and B to depict no hallux valgus, and grades C, D and E to represent hallux valgus. We then defined incident hallux valgus, so by that I mean people who didn't have hallux valgus at baseline but developed hallux valgus at the 7-year follow-up, as being those people who were classified as grade A or B at baseline, but then they went on to have a grade of C, D or E at 7 years of follow-up. We also then defined people as to whether their hallux valgus had progressed from baseline to 7-year follow-up. So for someone who has grade A at baseline, this could represent progression if they had B, C, D or E at follow-up. Similarly, someone with grade B at baseline would be considered to have progressed if they had C, D or E at follow-up. Someone with grade C at baseline would be considered to have progressed if they had D or E at 7-year follow-up. And finally, someone with grade D at baseline would be considered to have progression if they had E at follow-up. Now, obviously, we haven't included the grade E at baseline people here because there's no room for them to move, so they're excluded from this analysis. So here's the main result for hallux valgus incidence. You can see that at baseline, 1,032 participants, so 70%, did not have hallux valgus, but 450 or 30% did have hallux valgus. At the 7-year follow-up, you can see that of those who did not have hallux valgus at baseline, 825, so 80%, still didn't have it, but 207 had developed hallux valgus. So the incidence of hallux valgus over 7 years was 20%. So here's the key result for hallux valgus progression, keeping in mind that this is a foot level rather than person level analysis. So at baseline we had 2,950 feet, and this figure excludes those who had grade E hallux valgus at baseline because they can't progress any further. So at 7 years, there was no change in the hallux valgus angle in 2,231 or 76% of feet, but the hallux valgus angle increased in 719 feet, so the progression rate was 24%. So the next step was to examine the baseline characteristics of the sample to see if we can identify any predictors of hallux valgus incidence or progression. Now, those who developed incident hallux valgus were significantly more likely to be older. They had poorer physical health, as evidenced by lower scores on the SF-12 physical component subscale. They were more likely to have foot pain at baseline, specifically on the dorsum of the hallux, and they were more likely to have worn footwear with a narrow toe box between the ages of 20 and 29 years. Now, in contrast, there were very few predictors of hallux valgus progression, with those whose hallux valgus angle increased simply having less hallux valgus at baseline. So in summary, this is the largest prospective study of hallux valgus that's so far been performed in a population-based sample. And what we've shown with this study is that incident hallux valgus develops over a 7-year period in 1 in 5 people, and during that time frame, hallux valgus will progress in 1 in 3 people. So the key take-home message here for clinical practice is that hallux valgus may still be preventable even in those aged over 50 years.